School health and nutrition supervisors. So what was the job of these supervisors and school health staff? Training of teachers. That was one of the most important tasks that they were doing. They were training the teachers also because the teachers would come to know how to process the screening of the students even when the school health or nutrition supervisors were not available. So the teachers would come to know if there were indications or symptoms of any diseases and ailments that are being caused in the student's health. Sometimes the teachers have no understanding of some complaint that the student is making. Sometimes the teachers think that the students are just making excuse because they do not want to learn. So if the teachers are trained and they know how to identify a disease or a symptom that is causing some pain in the student's body, then they will be able to recommend that and refer the child to the hospital or inform the parents. So this was the job of the school health and nutrition supervisors, that they were training school teachers in screening of common ailments which are very common in children. And these are eye problems related to vision, because so many times the students cannot see the board, and when they complain the teacher, sometimes the teacher does not take them seriously, and she thinks that probably the students are just complaining because they are making it an excuse. But this is very common amongst the students, that they may have eye problems, there may be some infection in the eye, or they may be having short-sightedness and they are not able to read the board or the book. So the students would only be complaining if they have such a problem, and the teacher, if knows about the symptom, then she will be able to identify that the student is genuinely having that problem. ENT, also ENT problems and issues are very common amongst children. Ear, nose and throat. Because of the infections of cold and cough and influenza, the students usually suffer problems and issues and pains due to ENT problems, ear, nose and throat problems. So if the teacher would be understanding and if she is trained to identify the symptoms that are causing pain in the ear, nose or throat, or there is a running nose, or there is a throat which is rough and is paining, so then she will be able to identify the problem and the issue and refer the child to a hospital, clinic, or even to the school nurse. Dental problems are also very common amongst the children because their teeth keep on growing in different stages. So at different stages, children, they face some dental issues while the teeth are growing, and also they can suffer from an infection. Also, the teacher needs to make aware the students about how to clean their teeth and how to keep their dental health in balance so that they are not eating such food which are affecting the growth of the teeth, or the structure of the teeth is being imbalanced or not functioning properly because of the diet the students are taking. So this can also be a training and a teaching session for the students to know how to take care of their dental health. Skin and general physical problems. Also, the teachers were trained in identifying any skin problems which may not be clear to the students at all, and it would sometimes not be clear to the parents that the children are facing some skin problem. So if the teachers are trained and they can identify that there are symptoms where the students are suffering from such hazards which are related to skin problems, then the teachers, by the help of the school nurse, can also refer the students to the clinic, to the hospital, or inform the parents accordingly. And other general physical problems like fever or cough or any other disease that the teachers would be able to identify will definitely help the parents and the students and the school to make it possible for the student to consult a clinic or a doctor or a hospital to get that medical aid. Health screening by school health staff and nutrition supervisors, and teachers have started conducting health screening in schools. So by this training, the teachers now can do the health screening in school, and they would understand if there was any problem, any issue with the students, and they will be able to identify the symptom and help the child, and also refer the child to a clinic or a doctor.